Safety and health briefing. Before entering the teaching and learning facilities, kindly do this earlier at your home or your hostel room. 1. Install MySejahtera. 2. Assess yourself for COVID-19 symptoms. 3. Prepare necessities for disinfection. Assess yourself daily for COVID-19 symptoms. The common symptoms of COVID-19 are fever, dry cough, tiredness. Less common symptoms are ache and pain, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, skin rash, bluish discoloration of fingers or toes. Severe symptoms are breathing difficulties or shortness of breath, persistent pain or pressure in the chest, loss of speech, especially those associated with lack of movement, and sudden confusion. Reminder to all, you should be quarantined for 14 days if you travel or resided in a foreign country, you were in close contact with a confirmed case of COVID-19, attended an event associated with COVID-19. Associated criteria are history of attending large gathering involving many people from distant places, recent travel from areas or events associated with newly announced clusters, close contact with a person who recently traveled overseas in the last 14 days, recent travel in the last 14 days from red zone, EMCO or TEMCO areas. Please stay at home or at your hostel room if you have fever, cough, fatigue, or other non-specific respiratory illness. Please contact your hostel fellow for further action. Additional equipment for disinfection: hand sanitizers, paper towel, wet wipes, and towels. Upon entering the teaching and learning facilities, please always wear a face mask. Scan the side QR code upon entry. Check your temperature. Be familiar with the layout for entry and exit. If you are febrile, please go back to your hostel. Please wear your medical mask safely. Wash your hands before touching the mask. Inspect the mask for tears or holes. Find the top side where the metal piece or stiff edge is. Ensure the colored side faces outwards. Place the metal piece or stiff edge over your nose. Cover your mouth, nose, and chin. Adjust the mask to your face without leaving gaps on the sides. Avoid touching the mask. Remove the mask from behind the ears or head. Keep the mask away from you and surfaces while removing it. Discard the mask immediately after using, preferably into a closed bin. Wash your hands after discarding the mask. Do not use a rip or damp mask. Do not wear the mask only over your mouth or only over your nose. Do not wear a loose mask. Do not touch the front of the mask. Do not remove the mask to talk to someone or do other things that would require touching the mask. Do not leave your used mask within the reach of others. Do not reuse your mask. Use the stairs for any traveling within level 1 to level 7. Please sanitize your hands before and after using the handrails. Practice stairs etiquette. Keep your social distancing while traveling on the stairs. Remember, always use the handrails. Always have one hand on the handrail, especially upon walking down the stairs. Avoid any distractions while taking the stairs. Do not use your handphone. Keep your eyes on the stairs. Do not put your hands in your pockets. No tomfoolery or silly behavior while taking the stairs. Avoid carrying things that will block your vision. Practice 3C and 3W. Avoid crowded places. Avoid confined spaces. Avoid close conversation. Wash your hands. Wear a face mask. And please be warned not to shake hands. Always cover your mouth and nose upon sneezing or coughing. Always disinfect. And if you have any symptoms, please get treatment. Moments for hand hygiene. 1. After using the toilet. 2. Before touching other people. 3. Before touching any shared objects. 4. After touching your surroundings. 5. After touching possible contaminated surfaces. 6. After covering your mouth during sneezing or coughing. How to hand wash. Wet your hands with water. Apply enough soap to cover all hand surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to hand with fingers interlaced. Back of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb, clubs in right palm and vice versa. Rotational rubbing backwards and forwards with clubs fingers of right hand in left palm and vice versa. Finally, rinse your hands with water. Then, dry your hands thoroughly with a single-use towel. Use the towel to turn off the faucet. Your hands are now clean and safe. How about using a hand rub? Apply a palmful of the product in a cup hand, covering all surfaces. Rub hands palm to palm. Right palm over left dorsum with interlaced fingers and vice versa. Palm to palm with fingers interlaced. Back of fingers to opposing palms. Rotational rubbing of left thumb. Clubs in right palm and vice versa. Rotational rubbing backwards and forwards with clubs fingers of right hand in left palm and vice versa. Once dry, your hands are clean and safe. Please keep your distance at the waiting area, surau, stairs, library, lecture halls, laboratory, cafe, anywhere. When coughing, please cover your mouth and nose, either with tissue or your upper sleeve. Remember to put your used tissue in the waste basket. Clean your hands after coughing or sneezing. Wash your hands with soap and warm water or clean with alcohol-based hand cleaner. Inside your lecture hall, do this. Remember, in our lecture hall, we have fixed seating and cinema-like arrangement. Keep on your face mask all the time. Disinfect frequently touched surfaces using supplied alcohol and tissue paper in between classes. Limit sharing of objects. Remember, there is a one-way entry and exit point in the lecture hall. The capacity of the lecture halls after physical distancing with one chair apart. For Dewan Kuliah 1, there is 151 seats. For Dewan Kuliah 2, there are 144 seats. Therefore, some students will attend via online classes. And remember to keep on your face mask all the time. For surface disinfection, faculty will supply 80% alcohol without glycerin for surface disinfection. Students to use their own tissue with the disinfectant to disinfect the side table and handrest before the class and upon leaving the hall daily. Use wipe and discard technique. If during class you develop sudden fever, cough, fatigue, or other non-specific respiratory illness, please go back to your hostel and contact your hostel fellow. For online lecture sessions, we prefer that you use Microsoft Teams. Therefore, please install Microsoft Teams on your computer. Please log in using your own ID and password. Select either Year 1 or Year 2. Then join on the respective meetup to join the session. Do not click on the record button because the recording will be done by the lecturer only. At the end of the lecture, please click Leave Meeting. We also have Zoom, which is available upon request only. The lecturers need to contact the person in charge a few days earlier to use Zoom. Please install Zoom application on your computer. Select Join Meeting. The lecturer will provide the room ID and password. Use that to enter the respective session. Join the session. Lecturer will record the session. Please click on Leave Meeting at the end of the session. All questions for those online will be answered through chat. Any questions? These slides were prepared by Dr. Rosna Ismail, the Occupational Health Lecturer from Jabatan Kesihatan Masyarakat. She is available at this contact address. Thank you.